I'm Matt.
And I'm Chris.
We're best friends.
And brothers in the fire service. And this is the 360 Podcast. Welcome to 360 Podcasts. I'm Chris. This is Matt. We have two very special guests today with us. This is Dr. Wong from Advanced Wellness and Pain. And we do have our wellness coordinator, Matt Licardi's here with us. And we're going to talk about some of the benefits with the ketamine treatment that we're hearing a lot about. So Dr. Wong, welcome.
Thank you.
We're happy to have you here.
for
Thank you
coming out.
very much for coming and taking some time out of your day.
No problem.
We're excited to have you here. So please tell us about yourself.
I'm Dr. Greg Wong. I'm a board-certified anesthesiologist, and me and my two co-founder partners, Dr. James Latham and Dr. Deepak Sharma. In 2020, we opened our first ketamine clinic. That was during COVID. It was our COVID pivot out of clinical anesthesia and learning to try to acquire patients on our own and to help other people. And kind of during that interesting phase of starting this business, I have a good friend. His name's Brian Smith. He's a retired Phoenix firefighter and now is a nurse. And I met him through his wife, who's a nurse also, and she worked at the hospital at the time that I was working at in Mesa, Banner Baywood. And I told him what I started to do, and he said, "I got the dirty secret to tell you." Mm-hmm. And he told me all about the high incidence of suicidations and suicidality in firefighters and first responders. Yeah. And I thought to myself, wow, there's a real opportunity to help people here.
Sure.
And so at that point, start exploring, trying to connect it to fire departments. And then through that process, we came up with this program to treat firefighters, first responders, and now we're also treating police. And we've treated about 204 first responders over since that time now. Wow. And we really feel like we have a really good process to really help people. And when it first started, it was actually a research process. And the reason why it started as a research, we don't really want to be research, but we got a lot of pushback. One of our first meetings in Peoria was one particular firefighter. His father is a physician, and he was really kind of a negative type person. And
Sure, he's on the fence about it.
Yeah, and he said, where's your data support that you can even take care of people like this? And what he meant by was this is that they've had a little bit of data on vets, old trauma.
Sure.
But nothing ongoing, because obviously when you get treated, you go back to the job and you're having ongoing trauma on a day-to-day basis. You sometimes many calls per day. And we really didn't have any data, not that we could find. Okay. Maybe there was some data out there we couldn't find, but we didn't have data. So when we left the parking lot, we were like, oh my God, we just kind of butt slammed. Yeah. And I said to my partners, we need to start our own study. If we're going to make anywhere headway, we're going to have to get our own data.
Sure.
So we said, well, we'll self-fund a small study, and at that period of time, we got introduced to the 100 Club. In the 100 Club, we did a presentation to Gilbert, and the 100 Club simultaneously was a fire and police. And based on that conversation, they said, we want to help you. And really probably what it was, they already had funding for this, and they said, well, sponsor funding to do this. And so that's the majority of this 100 and, it's about 203, 206 firefighters and police at this period of time we've done. Yeah, so that's how it started. So that was a long-winded question, but that's how it started.
That's amazing. That's good information. And you're saying, so you're working with firefighters and police around the valley, all different departments.
Yes, all departments, amazing. And so I think you're aware of the 100 Club.
Absolutely.
100%.
And so obviously they take care and support all sworn officers, first responders, police, and fire. Yeah. As long as you're a sworn officer, they support you.
Yeah, they're literally saving lives.
Yes,
absolutely. The funding they provide.
Great partner to have.
Absolutely. We thank them every single day. They've been really a great partner with us, and they've helped us tremendously in our business. And the payback is that we've been able to really support people through the process. And so our program's a little different than other programs, because when I designed this program for first responders, it is different than a typical retail patient, because it was research. And the question was, how resilient is this going to be? Are they going to respond just initially and then fall off the cliff and go back to their same ways? And the question was, I don't really have a year to prove myself because I'm starting a business. Sure. So I really made it 3 months, and probably should have been 6 to 12 months, but that's what we started at. And so we collected data over a 3-month period of time. And so what it really looks like is a first initial treatment with preparation with our integration coach. And then what happens at the end is that you have a follow-up care. So we connect to your coach, so you're with your coach at least once a week or once every other week. So you have some additional support. And then we also offer a booster infusion, which sometimes people need it. Some will be around 4, 6, 8 weeks later.
So are you currently still collecting data?
We are collecting data, but the data is really not changing.
Okay.
And the data is really, honestly, fantastic.
Yeah.
And so what we're really proud about is that when we actually look at the data and compare it to which nationwide research papers show, it's better than theirs.
That's amazing.
And so that's what we're really proud of.
Okay.
But it's not a research design program.
Okay.
And so we really can't publish it because it has to be submitted and it has to be going through a process before it. So it's not good enough to submit. So we just kind of keep it internal, but we're really proud of it.
Good. Okay. That's awesome. Now, Matt, I believe you had some questions.
Yeah. So what kind of things are you using to, let me start that over, sorry about that. What are you able to treat with this ketamine therapy? What type of
absolutely.
patients are coming in?
So, ketamine therapy is really good for multiple mental health disorders. The problem when you find that the greatest value is PTSD. And obviously we find it right where we're talking about here. PTSD is the sweet spot, and I'll get into why, and in a few minutes I'll get into why I believe it's so powerful. Also depression, and that's what most people understand it as. So majority of ketamine clinics are treating depression because that hits the everyday population, right? The everyday population doesn't think of life as PTSD, but the problem is there is. They just see traumas differently than we see it. I mean, yours is very measurable. It's like you can point to it because of your job occupation. And other people don't see it that way. It's just a different form of trauma. And then it can help with anxiety. But anxiety is difficult, and I'll be honest with that. Ketamine doesn't directly treat anxiety the way most people think, but it treats it indirectly, but it still is very effective. Okay. And then we do treat chronic pain too. Not typical chronic pain, so the chronic pain we call neuropathic chronic pain, which is nerve-derived pain, which a type of nerve-derived pain would be headaches. That's nerve-derived pain. CRPAS, chronic regional pain syndrome, neuropathies, things like that, with people who are suffering from like long periods of pain. We can also treat with ketamine, but it's a different protocol. Okay. And but interesting enough, as I go down the path we're talking about that, we're finding, though, is that pain and mental health is interrelated. And it makes sense, right? Absolutely. People with chronic pain are going to start getting depressed. Yeah. But here's a way to think about it also. And the way I talk about my patients is that if you think about the microprocessor of where you interpret pain at, the way pain is interpreted in your body, it's actually interpreted inside your brain, right? So what's also correct is where does your mood come from? Your brain, right? So they're interacting. So there's not like it's like divided where pain's here and mental health there. They're interacting. As you think about it, it makes sense now, right? So what happens is that when people are in chronic stress are having what we call a bad day, their pain levels go up, right? And when people are having a distracted or good day from their disorder, from their pain, an anniversary, a birthday party, some celebratory or nice event, they'll notice like, oh my God, my pain wasn't so bad that day, was it? And that's because interpreting those signals coming from your body for pain are being modulated downward because you're not taking on those signals. And so your body says, oh, that's not so bad. Because people don't stay at the same level of pain. People in chronic pain, they have what they call range. Okay. We use this thing with like, what's your range of pain, 0 to 10? Sure. You've probably heard about that, right?
Oh, absolutely.
And so people don't say my pain's always an 8. They'll say, on a bad day, it's an 8 or a 9. On a good day, it's a 3 or 4, or maybe it's a 2. So what happens at range, you'll see that people go back and forth and maybe even, move through that different range in the same day, right? And that's interpretation of those signals coming with your body because most likely the reason causing your pain hasn't changed that day, right? It's still there. Whatever the impetus of causing your pain is still there.
For sure. Okay.
Right?
Yeah. It's kind of like that whole, the body keeps the score.
Body keeps the score, right? So these all interpret. So we've been starting to treat pain more from a mental health point of view now. Because we find that when you can get people to break that part of the system down, it really does affect the way they interpret their pain. But also what it can do is it can change your relationship with pain. Okay. So, really if you think about it, when you interact with anything, whether it's a thought, a person, a place, we have this emotional content to our life, right? And yet people have a relationship with their pain. Okay. And so you can change that relationship with your pain it's going to impact the way you feel about it on a daily moment-to-moment basis, right? It's a healthier relationship. Because sometimes we can never take pain completely away.
Right, of course. Absolutely.
Right?
So, can you explain how the ketamine works? And remember that we wear helmets to work, so keep it down.
Okay.
As best you can.
From a point of from mental health?
Yeah.
Okay, so
for treating PTSD,
okay.
for treating
So
trauma and depression.
I'll back up a little bit. Is that traditional treatments of mental health are antidepressants, SSRIs or NSRIs, and those work usually in the serotonin and dopamine receptor system.
Yes.
Okay, we all heard that, right? Sure. And kind of have a feeling what that means. Ketamine's unique, different. First of all, ketamine is an anesthetic, first of all, right? It's a dissociative anesthetic, and I'll get back to that in a second, but remind me too. So because it's a dissociative anesthetic, it works at a different receptor system. It's actually called the MDMA receptor, and it's the glutamate receptor, which is very different. And what we do is when we partially give ketamine, not an anesthetic dose of ketamine, it gets partial blockade of the receptor system. It increases glutamate circulating inside your central nervous system, okay? And then when we increase that glutamate in the receptor system, it causes another glutamate receptor called AMPA to increase something called BDNF, brain-derived neurotrophic factor. And that causes neuroplasticity. And so the concept or theory is that increasing neuroplasticity causes the emotional benefits that we gain from ketamine therapy.
Can you explain what neuroplasticity is?
Yeah. So neuroplasticity is really new neural pathways. So the way to think about it is that, so what is neuroplasticity? So basically what happens is that when we're under high stress, which is stress, anxiety, PTSD, something on the neurological system called dearborization. What does that mean? Is that the dendrites, think about these as two nerves, and they need to touch each other and talk. And they dearborize, and in other words, they stop talking to each other. So they're there, they're not dead, they're alive, they're just not functioning. And the way I like to talk to patients is like, you're a 5-lane freeway, lane 3, 4, and 5 are closed down, and maybe even lane closed toes down. You're only operating lane 1.
Yeah.
So it opens up these pathways. And so when it opens these pathways, allow what to happen? The brain to function more optimal, the chance to learn, relearn, reprocess things. So that's what's happening. So it's really allowing your nervous system to really function like it's supposed to.
Okay.
So, you had a question, I think?
Yeah, I know we've talked about, like you broke into the fire and police world and we're treating PTSD with it. Are you seeing other demographics of patients see benefits from ketamine? I ask because in our world, we don't hear about something, it works for one person, and then all of a sudden it's the best thing in the world for us.
Yeah,
right?
here's the great thing about ketamine. Every single person can probably benefit from doing ketamine as long as it's not limited for some reason. So there's certain risks involved with ketamine. In other words, the ones from a medical point of view would be, one is that it can get blocked, the care can get blocked by an antidepressant called Lamictal, because it also works on the glutamate receptor system, so we have to modulate that down or bring it down to a lower level or hopefully wean it off. Benzodiazepines seem to really inhibit a good ketamine therapy. And then obviously the physical things are severe coronary disease, cardiac disease, things like that, arrhythmias, uncontrolled high blood pressure, maybe someone who's really unstable angina, probably want to be really careful. These are not absolutes, but we have to make sure we have to clear them. Pulmonary problems, usually we have people lay back, so they have to be like maybe someone that's not morbidly obese where they can't lay still, or bad asthma, COPD, things like that. It is metabolized in the liver, so we want to make sure the liver functions are decent and not having stuff on there. Let's see. This is going to be a little controversial. The way I was trained is that ketamine could cause lower the threshold for seizures. But it's interesting though, is because a lot of neurologists who treat seizures are using ketamine for status epilepticus, which they can't get them out of it, so using ketamine to get them out of it. So we've had a couple patients with seizures, and we got them cleared by their neurologist, and they said no problem. So that's kind of one that we worry about. It can, you don't want to be dementia. It's probably someone you don't want to start because they're already at that part of their life where they feel fearful of like losing control of things, and it's a dissociative experience, and so they can lose sight and get they might feel like they're actually truly dying and like really panic and not do well with that and really scare them. And they may not be able to understand it when they come out of it because they're in dementia, right? Yeah. It's not like the lucidity comes back to them after the medicine wears off. And then we don't want to treat a bipolar person during mania because we don't want to excite them and don't want to, or someone, and we have to be careful about schizophrenics because obviously we want to cause a schizophrenic episode and push into schizophrenia. So those are pretty much where things are. But outside those things, for the most part, most people can handle that. Obviously, there might be a couple instances where it falls out that most people can benefit from ketamine.
Cool.
And the super majority of our patients are not, first responders, and they do beautifully through the process. Yeah.
Is there any concern with addiction to ketamine?
Great question.
For somebody who's either experiencing it for the first time coming to your clinic or somebody who's had an issue with ketamine in the past?
Right, great question. We get this all the time. So the way you want to think about, first of all, let's understand what addiction is for the most part. And I'll tell you the way I think about it. First, I'm not an addiction specialist, so I think about it in a certain capacity. Yeah. I think about addiction as no one wants to be an addict, obviously, right? No one grows up and says, I want to be an addict. But lots of things are addictive. Alcohol, substances, we talk about substances, but there's also non-substances that are addicting. Gambling, right?
Addictive processes.
Right, exactly. And so why are these things addicted to us? Because most likely people, I call it in a state of suffering. Something's feeling uncomfortable in their life. They're not dealing well with their life. And they're trying to dissociate or escape from that reality. And so anything that can distract them from that, in their mind is positive. And that's why probably for first responders, very common is alcohol. Sure. It kind of numbs the discomfort, right? So that's where addiction comes in. Okay, so let's rock that into ketamine now. Obviously, ketamine can feel very positive and sometimes euphoric. And so if doing with the wrong intentions, anything can be addictive. So there is a chance for addiction with ketamine in general. But typically that's when you get abusive usage, and that's when people are getting it on the streets, not being prescribed to them, or maybe possibly, we can explore this part if you want to about the at-home ketamine usage. And so at-home ketamine usage does have a chance for crossing over to that gray zone towards addiction, because when we do ketamine, it's very intentional. What does intentional mean? Purpose. Okay? So any time you do anything in life with purpose, it has a very different meaning when you do it without purpose. Right? Exactly, right? Mm-hmm. And the outcomes are very different. People do ketamine in the nightclubs. It's a recreational drug, right? And we know about that. And that's unintentional. That is what? I'm escaping. I'm escaping from my everyday job. I'm going to go out and party or whatever I'm going to do, and that's not the right intentions. And so you are crossing over that unintentional use, and that's where you can get into problems, right? Now, here's a real problem comes in is that you do ketamine, you do great with it, you like it, and it's like, well, I wanted to do this at home, okay? And when you start ketamine, there's a lot of intentions. So we start the process. Intentions are super important because it keeps you in the context of what am I trying to achieve here? I'm coming in here, I'm trying to heal my traumas, right? I'm coming here trying to work on my depression. I'm coming here, I want to lower my anxiety. But there's a process through that process, and you're going to go through that exploration in your work, okay? Now, what's the gray area between I'm coming home from a bad day at work and I'm going to work on myself, or I'm going to take this and escape because I had a crappy day at work and I hate my boss, or I had a bad interaction, whatever that is, right? Yeah. And so that's that gray area where you're becoming non-intentional, right? And now what happens is but you feel better afterwards. Mm-hmm. I think I did the right thing. Yeah. I feel better. Maybe that was okay. And you tell yourself, see the problem is? Sure. And so we believe that if you're going to be doing this work, it needs to be under the control of a provider that really has your back and has your best interests and can help lead you. And so doing medication and having access to medication all the time is an open box for negative things. Yeah. We're not totally against it, and there are people who can really control themselves, but there's also a lot of people who can't control themselves. Absolutely. And so that's the danger.
Would it be useful to somebody who has had a ketamine addiction outside of a clinic, who has done home use, or do you think that's the type of person that should maybe stay away from?
Someone who's addicted, has addiction or addictive history, they should never be doing any at-home ketamine. Right. Because you're high risk, right? Right. Why subject yourself to that high risk?
Sure, right. But I'm saying if they have addiction outside at home, should they come into the clinic? Would it benefit them?
Well, the thing is that they've probably done ketamine with intention, right? With the care, and with the care, it's going to have a different outcome. Okay. It'd kind of be like saying this, and it's hard, but it's nothing quite translate. Just say you were addicted to prescription opiates like oxycodone, Percocet, whatever. Say you had to have surgery. Yeah. You go home after surgery, outpatient surgery, you get your shoulder repaired, whatever. do you not take medication to go home? That's the hard part.
Right.
So that's slightly different because you're going home with it. But remember, when we give them, we're administering it, we're not prescribing it.
Right.
And that's a big difference. We're not sending you home with it. So we're controlling the dose. We tell you the dose. So if you ever leave to us and go to another clinic, which many clinics won't tell you that, we'll tell you the dose. We have no problem sharing your information to you because you should know. You know, because to let you know, in our process, we do share our doses because we have this conversation. This is not like I'm the doctor, I tell you what to do.
Right.
This is your dose. How do you feel about that dose? Oh, do you feel like you need to get a little bit more? Is that too strong? We'll back off. And we tell you so that you can have input.
Yeah.
Because this is a collaboration process.
Okay.
You know, our process is not about us. It's about you.
Yeah.
And it's not about, and so our egos don't get in the way of that.
Okay.
And so we do share all the time, and that's not true for any clinics. Because we don't want to feel like we own you as a patient.
Okay.
You're just our patient, and we have the benefit of being taking care of you. Okay. But a lot of medicine practices, their patient, they don't want to go to the patient because cost of acquiring a patient is very expensive.
Yeah. Okay.
I can't speak for police, but firemen in general are, I don't know, I guess, what's the word, standoffish maybe sometimes, but skeptical about a lot of things. But I think Matt hit the nail on the head, right? So you get a guy who comes in and says, hey, I just did these treatments, right? I feel amazing. My life's changed. My outlook's changed. You should go try it. What can a firefighter like myself never experience it? I'm starting to notice, like I'm getting angry, frustrated. My buddy says, hey, go do this. What could I experience coming to your clinic? Like the process, the intake process, how it works through the process, and if you could speak on that to give some, our viewers insight on it and maybe help them to make a decision.
Absolutely.
If you can paint a picture, I think it's the unknown is the biggest hindrance to.
Yeah, absolutely.
Showing up.
That's a big talking point. It seems to be. First of all, there's many firefighters that have already done the program in our. Obviously, we have a big number of firefighters inside the valley have done the program. I do encourage you to reach out to someone. If not, call our clinic and we'll connect you with so many of our firefighters afterwards, like, please, I have no problem talking about it. They're kind of embarrassed before they start, but after they've gone through their kind of healing journey, they're not embarrassed at all. It's like, I want to share. In fact, side effect is that many times during the first infusion, it's a lower dose. It's not as euphoric, but it's very comfortable and very calming. And people always say, during their infusion, they thought about 10 people they want to introduced to this, how they want to share it. It's very common thing for people to happen during the very first infusion. But anyways, what's the process like? First of all, what happens is that for your guys' process is that you get an application goes on your behalf. You kind of get a sponsor, whether it's through the 100 Club or through your guys at the PFFA. It's a benefit for you. Which is really fantastic because it's not just a benefit for you, but it's also anyone in your family that's on your card, your medical card, which will be your wife and children. So if you have adult or children who are dealing with something, and again, it works for depression, and I put my 2 daughters through it, one's for anxiety and for depression, so also there. So they get sponsored. Oh, go ahead.
An age that you would say, like, hey, that kid is too young? When is
fantastic question. The answer is, when we tell people, we've done it as young as 12 years old. Okay. But the real answer is, how mature responsibly from their thought process are they? If you have a 12-year-old who's mature and it's like, I get it, I want to work on myself, I want help, or asking for help, and they don't just want like a magic bullet, like, just give me something to make me better. Yeah. Many, even adults. And especially,
there's names running through my head that are not mature thought or thinkers.
Exactly. And so you have the older teenagers who do that, and the young adults who do that. But we've had a 12-year-old who was very insightful. And if you do that, you can work them through that process. Okay. Because you're going to get insights. And I'll break it down why I think it happens, why the medicine seems to really fix things, if you remind me. Okay. But let's go back to the process. So you get referred to us. And then as soon as you're referred, that same day, I call you. I want you in my clinic as soon as possible. I'm going to give you a call. You might not answer, I'm going to call. And then if you don't call in a couple of days, I'm going to call again and leave a message. And I'm going to call a couple of days later. And by that time, I figure you don't want to talk to me, so I'll give you time. I'll usually wait 2 or 3 weeks, then I'll keep hitting you again. And then I'll leave a message, and all it is, hey, you're approved. Give me a call. I'm going to explain the program to you on the phone. I'm going to answer all the questions on the phone. And I'm going to offer you a chance to get on the schedule. And so when I get you on the phone, I'm going to go over all the ins and outs of the program and then I'm going to do a medical review of your problems, review your medicines, review allergies, and then answer all questions you may have, all skepticism, all fears, and hopefully alleviate most of those things. And then we're going to get on the schedule. And then once you get on the schedule, there's a whole onboarding process. And the onboarding process looks like we connect you to an integration coach. What's really, really cool about our process now is that we have an ex-firefighter as our main integration coach.
Oh, that's awesome.
And he's an ex-firefighter. His name's Matt Contini.
He's from Peoria Fire.
Peoria Fire.
Yeah.
And he also is bringing on, he has a female now out of California, so she's from North, and I think he's going to bring on some others. So, and there's other firefighters who've gone to our program as they're kind of leaving their job. It's like, I think I want to do this. And so they're getting training to do it. And I think it's so cool because there's a certain way that you guys can talk to each other and kind of like be stern.
Yeah.
and camaraderie in the same way that maybe someone else can't say it. Plus also that when you guys want to discuss maybe something on the job, it really makes more sense because you could describe all you want. I can understand it, but I don't understand all the intricacies that we're going through. And sometimes having someone really understand that can like be in your head with you is really helpful. So I think that's really cool. Plus Matt is a really awesome coach.
I've heard
he's
him
really,
speak.
really good.
I've talked to him a number of times, and he's really helped our members. And he credits ketamine with saving his life.
Yeah.
He absolutely does, and he's found his niche. He's helping other firefighters.
Yeah, it's
to get
really
well.
cool. So
great.
So what happens at this spare time is that once you're scheduled on for the starting your program, is that somewhere between 1 and 3 days prior to that, Matt will schedule, or if you don't want Matt. And you want a female because we have female first responders, and you don't want a male, or Matt and he's too close to you. We have people we connect to our coaching partners called Being True to You, and they have a whole group of people that are specifically to our company. We connect into them, and then somewhere between 1 and 3 days they'll meet with you, and they're virtual because some don't exist inside Arizona, some don't exist in California or Canada, wherever else, and then they'll meet with you and they'll do a 1 hour preparation for you, and then we also at the same time send you a digital work copy of our workbook. And this workbook has all the details that you may need. Even something that in the middle of the night, you're like, I'm not sure if this is normal, it's inside there. Oh. And so you have a resource, and that comes in 3 forms. It comes into a hard copy, comes in a digital PDF that we send to you in an email. It even has an audio. I had a female reader read it for us, and so you can listen to it. And then the first time you walk into our clinic, we actually physically hand you that hard copy of that workbook. And so you have that.
That 1 hour, a few days ahead of time, you speak with the integration coach. Mm-hmm. What is it they're going over in that 1 hour? What are they talking to you about?
First of all, they're just trying to connect with you.
Okay.
They want to understand who you are as a person. They want to understand what you're going through. And then they want to hopefully support you understanding what's next, like what to expect, during the first infusion. And they'll go for more of a lay people person view. So it's really you get that softer side maybe, because we're clinicians and we may be cutting in a way that may be over your head maybe, and not intentionally, but our brains only work a certain way. We try to soften it up, and so there's a lot of preparation, and then also maybe some ability to review like how to prepare yourself, and that's also in the workbook. But they also reiterate these processes with you, and at that also time you're also going to get. Setting intentions. Now, intentions are really important, and the way we talk about intentions is like, what are your goals? Like, don't just say, like, I just want to be better. That's not a goal.
Sure.
Like, I want to have a better relationship with my wife. I want to stop being so angry and taking out on blah, blah. Like, I need to figure out whatever, like, have me more intentional about it. And not that you're going to get that answer right away, but that sets the stage for where your mind's working through something versus just like, because you can't be in an open blank piece of paper, because how do you fix that?
Yeah.
Like, right? So again, this is the process of starting introspective work. Really, that's what it really is. Yeah, it's starting to think about life differently. How does my brain work? And how am I going to work through a process? And now remember, ketamine done properly is not just about medicine. It's about reorganizing the way your brain works and using those thought processes to serve you better throughout your life. Yeah. Whether it's not just at work, it's at home and everything else. So that's really what ketamine is about. And so what's happening now is we're going to start diving into the mental aspect of thoughts and anger and grief and guilt and shame and all these other things that we feel, right? And so now what's going to happen is that you're prepared to come in for your first infusion, and then when you come in for first infusion, there's just some basic rules about not eating and drinking and other things, but we go over all that stuff, real basic stuff. Sure. And then you come in, and then we spend, we block off 2 hours, sometimes 2.5 hours for you for a 60-minute infusion. So the very first time you come to the clinic, you're going to get an infusion, but not right away.
Okay.
I'm going to sit down with you and sit with you for at least a half an hour, if not 40, 50 minutes, and just talk. And I'm going to go review why you're here, listen to your story again, so make sure I'm connecting to your thoughts, review why this works, maybe review our definitions about anxiety and depression, and how it works. And then we're going to teach you about the equipment in the room, some particular things about how to navigate the room, just the chair and earphones and eye shields and call button and other things. And then we're going to start an IV. We're going to dismiss you to use the restroom because ketamine is a diuretic, and we're going to empty your bladder, and then we're going to come back, start an IV, and start your infusion. And then we're going to guide you through some breath work and meditation, maybe even we call it a body scan.
Are you present the whole time the infusion's going on?
So all this period of time when you first met in for that first hour or so, I'll be present in the room.
Okay.
That period of time in our clinic, we leave the room.
Okay.
And I'll tell you about the philosophy about that. Then we'll come in periodically to check on you, but we're trying not to engage with you.
Okay.
And that's necessary. And then at the end, we would start engaging back at the end. So during the infusion period, which is that 60 minutes, very little engagement if necessary. But if necessary, there are times when people need help, and we engage as much as necessary. And the reason why that is because the way we treat ketamine, treat ketamine as what we call a psychedelic medicine. And not all clinics embrace that concept. What does psychedelic mean? Psyche means mind, and delic means revealing. So really when you break that down, it means access to the subconscious mind. What is the subconscious mind? So the subconscious mind is just a part you're not aware of at any time. The conscious mind is what you're aware of. That's what it is. I would look at the mind as a big box, and the top of it's the conscious mind, the bottom of it's the subconscious mind. And anything you're aware of, you're conscious, like our conversation now, something that you're not aware of right now that you're doing, that's subconscious. And my greatest example of the subconscious mind working, so here's another fact. We have about 60,000 thoughts a day. 75% are subconscious, only 25% are conscious. So we're always working the subconscious mind. The greatest example, because everyone will relate to this, is leaving for work in the morning in your car, arriving in the parking lot, you don't remember closing the garage door.
Yeah.
You drove completely normal. You didn't run over anyone, you stopped at the stop lines, you stopped at the stoplights, you navigated traffic, and you completely drove normal, but you don't remember driving 1 second. That's the subconscious mind. Okay. So that's how powerful the subconscious mind is. So now you get the subconscious mind, you're there all the time. Another example would be you come in the house and you have keys in your hand, you don't throw them on the ground, do you? You put them somewhere, consciously put them somewhere. But 5 minutes later, you have no idea where you put them. Yeah. That's the subconscious mind. Subconscious mind's still working, you just don't know what's going on there. Yeah. So that's subconscious mind, okay? So what does ketamine allow us to do? Now, ketamine allows us access to the subconscious mind, which is really what's important, because let's talk about definitions now. So I'll talk about, now these are talking points I talk about. So if you hear me in my clinic, you'll hear this again. Okay. So what is anxiety, right? Anxiety is fear. Fear is a very powerful word, right? No one really wants to be known they're fearful, especially men. How about uncertainty? Mm-hmm. Softer word is uncertainty, but not in the moment of the future. So the moment beyond now. 5 minutes, 5 hours, 5 days, 5 years. So you're living in the future, which was not comfortable, and that's anxiety. So you're fearful what might happen, but the reality is you don't know what's going to happen. We can't predict the future, can we? We have no idea what the future is going to happen. Sure. But it feels uncomfortable to us. My belief system is the reason why we fear that is because enough negative stuff happened in the past that your brain is basically saying, well, if yesterday stunk and the day before stunk, tomorrow's going to stink, right? So I think we're projecting continuation or whatever's going to happen. So that's anxiety, right? So depression and obviously PTSD are the past, right? So the only way you could experience depression or anxiety is experiencing the past or the future. Okay. So it's very hard to experience those in the now. But I'll get to, there's other parts where your system can get hijacked, which is the feeling of anxiety. We'll get into it a little bit later. And I have some stuff to show you that I think that we'll talk about also about what we do also on top of ketamine to try to act these things. So let's break down trauma a little bit, okay? Trauma basically is really, really a maladaptive response to a negative situation. So a situation occurs, right? And we react to it. We all do it. It's a oh boy, that was blank in a very powerful way, right? Mm-hmm. And I always look at it as a thread. So think about the neurocircuitry. Like, how do you picture your brain working or neurocircuitry? I think of it as, I cartoonify my thoughts and everything. So I look at it as like a drawing in my head of like the wiring inside, the wires inside here. It's like circuitry going through that, right? So you're creating a circuit as a memory. So how do memories form, right? Repetition, right? How do we learn? Repetition, right? So when you ruminate or repeat something over and over again, you're going to solidify that neural pathway or make it a memory. So when you have that event and you ruminate over it, you're making it stronger and stronger. So I always picture it as like the first time you think about it, it's like a thread being formed. If you never think about it again, that thread is easy. Like you grab a thread and just pull like that and snaps, it's gone.
Sure.
Right? But think about it over and over again. You can say like how it's like reinforced, and now it's a small thread. And even more, it may become even a small rope over years, right? If you go back and think about it. Something like really bad that happened to, like some bad event in life that you just can't let go of. So now you understand how I think of a trauma.
Sure.
Now for you guys, it may not be a singular event. Now every single trauma has a different weight to it, right? Loss of a loved one is a boulder or a brick, and other ones are smaller like a rock. And then sometimes like maybe just an argument with your spouse. It's like, oh my gosh, she's so right. And you feel like a little less of yourself because she's right and you're wrong for yelling at her.
No, I'm never wrong. Never. None of us.
But we do get a little bit of negativity that feeds back into us, right? I call those pebbles because they're not that big of a deal, but enough of them.
Why did they make it such a big deal, Dr. Wong? Stop it.
We're all related to this. As men,
as
men, we all relate to this, right?
Yeah, sure, absolutely.
So now I look at this thing. So now I look at life. This is the way I look at it. I teach my patients this. Like, we have this backpack, right? And I call this the subconscious backpack that's sitting right on top of your shoulders. And you keep shoving this garbage inside this backpack, right? And so we call it a cumulative effect. So it could be, for one of you guys, it could be one singular event. But many times it's not a singular event. Yeah. It's a cumulative dosing effect, like cumulative event effect, right? So we basically start accumulating all this and we start filling it up. And I always feel like I like this, everyone understands this common saying, my cup is full.
Yep.
How about my backpack is full? So think about it as a backpack.
Yeah.
That makes more sense. I like men backpack, right? We have backpack.
Absolutely.
So your backpack's getting fuller. And so the difference between your capacity, maximum capacity, remember, you're going to fill it up eventually. Because here's the reason why. Can you erase your memories purposefully? I can't.
I don't think so.
So we're accumulating these things, and what happens because we're uncomfortable with us, what do we do with them? We repress them or suppress them. Yeah. So we're just shoving them in our subconscious mind, right? Exactly what we're doing. We're just making them unaware of it. We still know it's there. Yeah. But at the moment, I don't want to deal with it. I can't deal with it. I don't have capacity. I don't have the skills to deal with it, right? So what happens is that you fill that up is that difference between your maximum and where you're sitting at, I call it your resiliency zone. So you can see how your resiliency decreases. You guys talk about it a lot. That's a big word inside. So think about why your resiliency is going away. It's not your fault. You're not broken. It's not your fault.
Yeah.
You're just full.
Yeah, I think there's tons of reasons. And
so your resiliency drops down. And so I always like to say, and actually Matt Cantini came with it. He was like, I like to talk about reaching into the backpack and taking rocks out of the backpack and putting a rock garden. What he means by that is that we're not denying these events occurred, because we're not trying to erase your memory. That's not healthy. Because they're still part of your history, part of your journey of life, but you're not carrying them.
Yeah.
So you can turn your head at any moment and acknowledge them and go, yeah, that happened, but you're not carrying it anymore. So that weight goes away. And that's usually what people feel initially, is that they feel lighter. The first thing that feels like, yeah, I don't feel so stressed. I feel lighter, like I don't feel so irritable. When I do get triggered, I can pull myself out of it. That's usually what happens first. And then we start doing the deeper work. They find more meaning to it. They're finding connections to these thoughts. Like, oh yeah, that was a big one. Oh wow. And a lot of times there's tears and other things that come out because they feel so relieved. The thing that is, let's dive this into a little bit while we're at this, is that, when you sit in this chronic state and you're suffering and you're aware of it, you don't want to admit it, but you know of it, you feel pretty hopeless. You've gone to therapy, you tried medications, you tried counseling, you're twice divorced or whatever's going on. Like, you feel like, I am broken, there's nothing else can help me. That hopelessness leads to suicide ideations. Yeah. Because you feel like there's nothing that's going to help me and I'm in the worst place, it's only get worse. And so what's really, really cool about ketamine It's the most rapidly acting medication we know that stops suicide ideations. Even before trauma and depression and everything else, it can stop in as single as 1 infusion.
Wow.
So that's really important. So anyone who's suicidal and you feel like you need help, try ketamine at least 1 dose because it can break it as early as 1. Not saying it's going to, I'm not promising it's going to, but it can.
Right. Sure.
And we've seen it very commonly happen as quickly as 1 infusion. It can take many more. And there's, like anything in response to any medication for all patients, there's that bell-shaped curve, and here's where most people are. There's people out here and there's people out here. So, I just want to make clear that just because supermajority fall in this, you might fall outside the curve. And also, in full transparency, that ketamine doesn't work for every single person.
Of course.
There's going to be probably about a 10%, maybe depending on the situation. And there might be some external circumstances like medications and other things why people fail. It can go up to 15%.
Okay.
And I think majority of our failures have been medication interactions.
Okay.
So 10 to 15%, they don't have positive results with
They
it.
don't have response,
but
or so.
the vast majority do have positive.
Also, we have to be careful about what success means. And so
Right.
we have a pretty stringent definition of success for us. And for PTSD, for what we're talking about here, it's a 50% reduction in their symptoms on their what we call the PCL-5 score, which is a trauma score. So it goes to 0 to 80, and 80 being most symptomatic and 0 being least symptomatic. And we want to see at least a baseline before care, and at least a 50% decrease. And so of the people who respond to us, we're seeing a 79% decrease in their symptoms.
Okay.
That's great.
And if you take all, even including failures, during that study it was a 69% decrease in symptoms, including failures. So that means that 0 weighed into that score, so that brought it down.
Okay.
Wow, that's great.
Okay.
So what's going on with them when they're during the infusion? What's happening with them?
So it's really going to be dose dependent. Okay, so obviously, we always start from an underwhelming dose to a more challenging dose. And so now remember what's really neat about intravenous ketamine versus other forms of ketamine is that we're not giving all the medicine at once. It's on a syringe pump and it's slowly being infused drip by drip at every single second until we turn it off. And we do it over 60 minutes. So typically, just say the dose was 60 milligrams, which would be a little high for a starting dose, you'd be getting 1 milligram per minute. So after 5 minutes, you have 5 milligrams. 10 milligrams, you have 10 milligrams. So you haven't had 60 milligrams in your body. Okay, does it make sense?
Yes.
Yeah, absolutely.
So now other options like intramuscular means I'm going to give you all 60 milligrams in your muscle,
Yeah.
and it's going to get absorbed slowly inside your body, and it's going to be dispersed. Now the issue with that is that depending where the muscle is, there may be an artery or vein there. The closer it is, the more fast it's going to be absorbed. And so it can be a little bit less controllable. It's also going to get very peaky. So if you want to think about what ketamine feels like when it comes on, obviously think about this being 0 in your blood. You're at 0. It's going to slowly ramp up. It's going to hit steady state until we turn off the pump. It's going to kind of go down. So it's kind of this like steady state thing, and we feel like that's where you can do your work in.
Okay.
Intramuscular, which is that injection shot, goes up like this, kind of hits peak, goes way higher, and then comes back faster. So it's shorter because it's going to be about 20 minutes-ish, 25 minutes, depending on the patient, where you're going to feel that medicine. And there's other forms of administration, which would be intranasal. So they have a liquid nasal ketamine, which is Spravato, which is actually FDA approved now. And that is a lower dose, and it's through the nasal, absorbed through the mucosa in the nose. And then also oral. And that could be done through a troche or a tablet that goes dissolved in your tongue, or a troche which is dissolved in the pouch of your mouth. And that's orally. Now remember, when you give it in the vein, 100% in the vein is going to be administered to you. So if I give you 100 milligrams, you're getting 100 milligrams. If I give it to you nasally, it's going to be in the back of your throat, get absorbed in your stomach, and so it's not. So on average, they think orally, it's between 10 to 40% is absorbed of what the dose is, absorbed orally. And nasally, somewhere between about 50 to 60% nasally. And then intramuscularly, I guess 100% is going to be absorbed eventually, but maybe not dispersed, and maybe some may be metabolized before it gets there because it's not always going to hit the vein or the artery, the vein, sorry, absorbed in the vein. So it may not be absorbed in the system. Now, what's neat about IV ketamine is that if you're having what we call a challenging moment that you need assistance, we can usually talk you through it. But if it doesn't and you need help, we just hit stop button, talk to you, hold your hand, whatever, to help you, and let the medicine come down quite quickly because we haven't given you all the medicine up front.
Gotcha.
It just comes off very quickly because ketamine is a very short-acting drug.
Yeah.
And its half-life is 2 hours, so it comes off very quickly.
So you were talking about that once they reach that plateau where we're nice and steady, they're getting the ketamine. You said that's where the work is done. What work is being done? What is happening when they're at that plateau?
Okay,
it's got a therapeutic level. What's going on in them?
So yes, exactly. So again, the response to the feeling, that experience you're going to get with the medicine is going to be dose dependent. So typically at the very lower doses when we first start ketamine, it feels floaty and relaxing.
Okay.
So think about people who have high anxiety. You might even have anxiety yourself.
Sure.
And so when I feel anxiety, I always feel like it's static in my head. It feels like it's like this distracting noise on top of my head that's really allowed me not to focus on what I'm trying to accomplish. That's why I think about life. I feel like I have that all the time. But I think when anxiety, it magnifies really heavily. Like there's a lot of, you remember the old-fashioned radios where like it's not quite tuned, it's
Yeah.
feels like life's that way. That tunes out. It becomes very quiet and it's calming to your brain and you feel very relaxed. And that's the first part of what we will try to get to our process because I think that's valuable. Mm-hmm. So I'll let you know, all of us in our clinic, every single person in our clinic who's worked on clinic have done ketamine. Okay. So I know what it feels like. So I did it too. My partners did it. So we know what it feels like. In my very first dose, I literally felt like I was sitting in the chair we were in and I was launched to space in the dark. If I opened my eyes, I knew I was sitting in the chair. If I closed my eyes, I felt like I was in space. But I felt like all my problems were left on Earth. And it sat there for an hour. And afterwards, they came out afterwards and they said, how was it? And I said, I didn't say good. And most people say good. I didn't say good at all. I said, everyone needs to do this.
Yeah.
And so I said, why would I say that? Like, it didn't make, like, that's like not a typical response for myself, right? I reflected on that and I felt like, oh, that quietness, everyone can use. Mm-hmm. Like, as an adult, I never felt that emotionally relaxed in my life. And I said, wow, I think everyone could use that. You know, just have calm down for a minute.
Absolutely.
So I thought that's what I meant by that. So now, as we go up in the dose, it's going to start getting to these more. Now, some people have visions. Ketamine is not a very visual psychedelic, very like LSD, but people can have visions. In my experience, about 30% of my patients don't have visions or more darkness or more shadows, things like that. I personally don't see visions. Other people can see things, people, place, things. A lot of times it's places. It's more like landscape, rocks and water and trees and mountains and, you know, skies and whatever. And then you start feeling this like, it'll probably start stimulating certain parts of your brain that feels almost like euphoric, mildly euphoric, not like manic euphoric, like pleasant. Yeah. And maybe some colors, bright colors. And now remember, our brains associate colors with emotion, right? Whites, oranges, yellows tend to be more positive, happy, joyful, and black colors, which are black, grays, browns, purples, dark blues, tend to be more negative, deeper, you know. So you kind of go in, some people go in and out of bright colors and dark colors, and I think it's your brain showing different emotions. But.
So I just kind of wanted to go over and just kind of repeat a little bit of what you've told us here today is that, so with the ketamine, the process is kind of, they get approved through Public Safety Crisis Solutions, which is part of our insurance through the PFFA.
Only for the PFFA.
Yes.
If it's not the PFA, it goes through basically fill out the form to send to the 100 Club and then it gets approved.
Right. So we have those options. Because we have PFFA, it goes through Public Safety Crisis Solutions. They get approved and they'll get set up, they'll get an appointment, but then they'll start working with an integration coach. And then it's 6 sessions, preferably over 2 to 3 weeks, preferably off the truck, off work, so you can focus on yourself, take advantage of that neuroplasticity, and then over the course of that next calendar year, they can do up to 4 more infusions as kind of a tune-up to keep them going or
yeah, absolutely.
Help them through.
The one thing that's different between the PFFA process is that there's only 3 hours of coaching built into it.
Okay.
And through the 100 Club, it's 8 hours of coaching. So that's the advantage there.
Okay.
But the PFA offers the infusions.
Okay.
So, but
that's good to
you know,
know.
the thing that's nice about when you're starting to work on yourself is that it's nice to have a coach because think about a life coach.
Yeah.
They help you accountable. Just like you use a coach or a personal trainer or anything else, they help keep you on track.
Yeah.
Right? And so even if you go to your coach a half an hour once a week or once every other week, I think it can be very useful to make sure you're staying on track.
Yeah.
And I think it's really important that you do when you go through this process is that you monitor yourself and not just like say, well, I'm good. and I'm not going to ask for help until like I'm in crisis anymore.
Yeah.
I don't think people, once you go through this process, I don't think you should need to live in life through crisis.
Yeah.
Like, why?
Right.
Like, what's the need? Like, you've lived that part of your life already. You don't need to do that anymore.
Yeah.
And so I think there's what we'll call maintenance to this process. And so what does that maintenance look like? There's many people, including firefighters, who are like, oh my God, I look like completely different, and I'm very intentional about my life. I do meditation now all the time, and I have a routine, and I'm eating cleaner, and I'm working out more. And the problem is that when we're in crisis, we don't have energy to do anything. Our self-care goes to crap.
Yeah.
Right.
No, I've experienced that firsthand with people where they're in crisis, and I give them a resource, and they can't even have the energy to dial the phone to call that resource.
I call that emotional energy. I don't know what else to call it. I come with an idea of emotional energy, which means you don't have the energy to do anything. Even though intellectually you know I need to go do this. I need to go do this. I know this is bad for me. You just sit there and go, you know what? I don't got to mow the lawn. I'm not going to do my laundry. There's people who are really bad position, like they don't even want to take a shower.
Yeah.
It's too much work. It's too exhausting, emotionally exhausting to do these things, right?
Yeah. I also want to share that, in my position as the wellness coordinator, I'm not familiar with everybody from our department that has done ketamine therapy, but everyone who has confided in me or I've helped, facilitate them going there has given rave reviews.
Yeah.
They said that it's been amazing, it's been life-changing. I've had spouses reach out to me and say, oh my gosh, what did you do to him? Because he's himself again. I haven't seen this guy in over 10 years and he's back, and it's life-changing.
So that's the other thing I think about. If you start thinking, don't just think about yourself, think about your extended family.
For sure.
Because they deal with you.
Yeah.
And the other thing that's really cool, which the PFFA actually brought up, there's something called secondary trauma.
Absolutely.
Right? You know about secondary trauma, right? Mm-hmm. So we're not supporting secondary trauma, but now we can.
Yeah.
Mm-hmm.
So as you think about this process, as soon as you feel like you're better, think about putting your spouse through it. Because they're living through life. And you've been married for 10, 15, 20 years, they're living it. They don't see what you think, but they're feeling it.
Yeah.
And the other part is that they're not really going to understand what you're going through, because you may not be having the best relationship because they're going through trauma too, and two irritable people don't get along well with each other. So maybe that could also help your relationship too.
No, the one I'm specifically thinking about, he went through it, and she contacted me and said how life-changing it was. She ended up doing it as well, and she had a great experience as well.
Yeah.
So it's good stuff.
Yeah.
It's a great another tool that's available to us that wasn't available to first responders 20 years ago.
Absolutely.
It's so refreshing to see in our careers, and it's really started to take off more. We're younger in our careers, but I know, Matt, you've been around a little longer.
A little bit longer. You see the white in my mustache? Is that what you're talking about?
I wasn't going to say anything. But to see, cancer prevention, mental wellness prevention, everything that is getting pushed towards first responders to benefit them, to extend their careers, to help their families is just amazing. And people like you and your partners who take on these responsibilities, we can't thank you enough.
You're welcome.
Because it's unbelievable to have that, and the PFFA backing and the 100 Club and every entity that's involved to help us be able to provide these services to the community is unbelievably amazing. So thank you so much.
It's honestly, it's very rewarding as a community to be a part of. Yeah. Because honestly, working with first responders, firefighters is honestly really a pleasure. You guys are honestly not difficult to work with. No joke.
Hold on, we'll talk again.
No, I'm serious.
Next episode.
No, because there's a discipline that you guys still have to do your job.
Agreed.
Now you have to remember, a lot of people who work in the work people don't have a lot of discipline in their life.
Yeah.
Mm-hmm.
And if for the most time, if we guys give you instructions, for the most part, they follow those instructions. Yeah. And that's all we can ask, because we have the most beautiful process in the world, but if you don't follow the process, it's not going to really be very useful for you. Yeah. And like we said, we can lead a horse to the water, we can't make him drink.
Sure.
So we try that.
Very
So are going to have, you're right. We've done hundreds of first responders, and not every single one gets fantastic results. There's multiple reasons. They may be in a bad situation. Now, here's the one thing you have to understand about psychedelics or mental health or ketamine specifically, is that ketamine is not going to change the reality of your life.
Right.
Correct.
If you're in a very stressful situation that's in your face at all times, it's not going to change that. And the great examples are be a divorce, a separation, a lawsuit.
Sure.
Those are real, stimulating, emotional content of life that doesn't turn off until that goes away. So I had one firefighter, I believe a firefighter, yes. He said, I don't want to start till after I finish my divorce because I think it was probably contentious.
Yeah.
And he's probably not going to be in a good mood no matter what happened.
Yeah.
But I've also had people say, well, I'm getting divorced, it's over, I know it's over. And they might not be comfortable, but they're coming to the point where they're accepting of it. Oh. Now they're trying to move on. And so even though they're kind of in it, they still come and do it, and they worked out fine.
It can kind of bring them to that neutral location where their reaction to
it could help you bring more acceptance to life and calm the system down. Mm-hmm. Now, you said something whether it's tools, and I always say this, when you first come to us, we talk as a treatment. When you leave us, we tell as a tool. Because I don't want anything ketamine as a treatment anymore once you've finished that, when you're in a good place. I want anything as a tool. You guys have tool belts and everything else. I always say, like, you have all these tools in life, therapy and all these resources. Like, just think as ketamine as a tool in the tool belt that you reach for when you need it. Yeah. If you use the tool properly, it can be very useful and very efficient. And so we tell people, just come back for, we were talking about maintenance, and so just come back for a booster. You feel like you're needing a reset. We called, the software reset button to be able to reset. So a single infusion can bring people back into a really calming place pretty quickly, as long as they don't completely jump off the cliff, right?
Gotcha.
If you're really in a bad place, it might take more than one infusion to get you back where you need to be. But we can get you there.
Sure.
But it's hard now because you kind of miss the point of the first round of working on yourself and not falling off the cliff and reaching out for help early and all these other things we talk about. You kind of missed that talking points. And so now are you going to hear them the second time? Hopefully, maybe.
Yeah.
But maybe some people are just that stubborn, they're never going to hear it. They just how...
You got the word, you got the S word. Some firemen are stubborn, man.
Well, there's certain people who are just very passive on all aspects of life.
Yeah, absolutely.
They don't want to be held accountable for any part of the thing going wrong. They're really hard to get long-term results on because they're more in the victimization mentality of life, which everything's not my fault and you need to fix everything for me. And they're looking for, unfortunately, called the magic bullet or the magic pill or whatever you want to call it. Right. And that doesn't exist in life. That honestly doesn't.
Is it fair to say that if you take the program seriously, you put in the work, you'll see better results?
There's going to be, as long as you don't have medications against you and not that 1% or 2% outliers, you're going to see a tremendous result.
Awesome.
Yeah.
Do you guys have any other questions about ketamine specifically?
No, I think we've covered
a lot of ketamine. We're ketamine out.
would you take a few moments then and kind of briefly talk about what stellate ganglion blocks are and how it can benefit our people?
Sure. So before I go into that, I want to talk about the autonomic nervous system.
Oh, yeah.
So if you know about the autonomic nervous system, I'll do a review, but if you don't, I'll try to explain to you. You have two parts of the autonomic nervous system. One's called the sympathetic, the opposite side is called the parasympathetic. Think of it as two parts pulling against each other, like a tug of war. Okay? If you have more sympathetic, that's flight or flight. If you have more parasympathetic, that's rest, relaxation, digestion, and safety. And they're two different arms of it. They're not the same. So there's two ways you can stimulate the sympathetics to go into more fight or flight, or you could block the sympathetics to more, when you block it, it's getting more tug of war going to the parasympathetics. Or you could stimulate the parasympathetics and push it towards the parasympathetics. So that's what we're doing. So now we have some ways to try to address that. So why is this important? First of all, why do you do ketamine? Remember I talked about earlier that anxiety is kind of stubborn to treat because somehow along the way, when it's chronic stress state, we get called something called autonomic dysregulation, which means the sympathetics hijack the system, which means even when it's not supposed to be on, it's turned on. We always think it's stuck in this circuitry loop and it can't get out of it.
Yeah.
So one way is to block the parasympathetic, or activate the vagus nerve, which are the parasympathetics, which are vagus nerve stimulators, and many of you heard about that, and I actually have some here. The other way is to block the sympathetics, and that allows you to fall into parasympathetics, and that's where the stellate ganglion block comes. And starting December, our clinicians start doing those for our patients. And we do something slightly different. It's theoretically a stellate ganglion block. It's actually called a dual reset sympathetic block, and the difference is that typically classical stellate ganglion block is at cervical level 6, and the stellate ganglion actually has somewhere between C7 and thoracic 1, and that's where the ganglion sits. And so why do we put it there? It's because there's a vertebral artery there which you want to stay away from. So we don't want to put a needle in there because we don't want to inject into the vertebral artery, which will go into your local anesthetic, go into your brain, which will be very bad. So we go at sea level 6, and then we do a second injection at sea level 4 because we actually have 3 ganglion inside there, the superior, middle, and inferior, which is that stellate ganglion, and we're trying to bathe a local anesthetic, which people don't understand is Novocaine. We don't use Novocaine. Other people know lidocaine, which is not lidocaine. We use something called ropivacaine, which is a longer-acting, safe medication. We bathe the nerves there. And it's going to fall asleep for about 4 to 6 hours. And while it falls asleep, it seems to shut off the sympathetics. And what we're really doing is firing into the amygdala. So it shuts off that signal in the amygdala, and your brain goes, oh, this feels much better. Okay. This feels, I could do with this. Because while you're firing the amygdala, what does your brain go? Something's wrong, something's wrong, something's wrong. And so now as your brain took and also that something wrong is that static. And what happens is you clear thoughts, you feel less responsive, you feel calmer. And so when we do that, and the way we want to think about it is called the hardware reset. Mm-hmm. So we think about ketamine as a software reset, the thought process, stellate ganglion blocks, or the dopamine reset block is the hardware reset. So they're synergistically, they're operating differently on the nervous system, and they're synergistic. So when you do them together, you get better results.
Oh, wow.
Okay. So typically when we do a stellate ganglion block now is that we typically start on the right side. And for some reason we seem that humans seem to have most humans have a dominant right side stellate ganglion, which means the stellate ganglion on the right side seems to be more effective than the left side on this process. Doesn't mean the left side is not functioning, but seems to be right side dominant. So we start on the right side. And of that, about 20% of people are not going to respond. If you take those 20% and do the left side, about 80% of those people respond. So on the whole, again, about 10% probably are not going to respond to it.
Okay. All right.
But here's the cool thing is that if you do the right side and you do the left side, whatever you get from the right side, you add on more to the left side, about a 10 or 20% more increase. So not so significant, not necessary, but if you can afford to do it, do both sides because why not put more onto that process. So typically, we know some people doing both sides. Okay. Now we don't do both sides for technical reasons on the same day.
Right.
For safety reasons, we do right side, and then we'll come back within 1 to 7 days later and do the left side.
Okay.
So I'm familiar with at least 3 of our members who have gone and done the stellate ganglion block, and they've, again, said they had great success with it. One of them went to inpatient treatment because he had a lot of trauma in his life. So the decision was made that he was going to do that. He said the treatment modalities were not really having a positive effect until he did the stellate ganglion.
And then
he said it just jump-started all the treatment started to help him, and he really...
What I'm thinking is happening there, and it kind of makes sense if you think about it. Okay, so I said your kind of sympathetic nervous system hijacked your system. Okay, so think about the signal going in your amygdala firing all the time. It has nothing to do with thoughts. Just think about it as a runaway circuit, right? It's full going on there. And the reason why it probably is because you've turned it on so long, it doesn't know how to turn off. Chronic stress.
Sure.
Chronic state of stress, PTSD creates that stress, right? So that's probably what's happening, and it's on more than off. Now, is it like 100% all the time? Maybe not. So there's probably a gradation to it, but it's on all the time. So now, no matter what you do on top of that, I give you ketamine, and you're resolved, you're conflict with your father and your mother, and all that happened in your life, but yet it's still firing. So even though you feel better about certain things, still something doesn't feel right.
Okay.
So that's where I think this can be really helpful. And I don't think it's necessary for every single person.
Sure.
But it certainly won't hurt.
Yeah.
But really for those people who are really hijacked, and those are the people who you'll see in constant fight or flight. So what does that feel like for most people?
Yeah.
For sure.
Women curling their hair. Yeah. Because we know what they're trying to do? They're trying to self-soothe. Their system's on all the time. They're trying to calm that system down. Yeah. So they're trying to find mechanisms to calm it down. So they're stuck in it all the time. Even though they're not that. They're watching a movie. Yeah. They're watching a comedy. They're watching a Disney movie with their daughter. Why are they doing this? Their system's fired up, right? So this is where we can calm the system down. Because it's not about fear. They're not in fear. But they still feel it.
Sure.
So this is where this hardware reset's necessary. And now we're starting to layer this stuff into our process. And now we feel like, okay, now we have more tools in the tool belt to help people,
absolutely.
Right? Because it's not exactly the same. But what's really cool about it is that the first studies that were done on stellate ganglion blocks for mental health, They also treat chronic pain. So they treat that CRPS in the arm and upper extremity. But what's happening is that when they start doing this on vets, just that, no other therapy, it helped with their PTSD. So that's why it was helpful. But now that you calm the system down and you shut that part off, now you can do cognitive therapy. You can do EMDR and other things on top, and they're going to be more effective.
Yeah.
So it makes more sense.
All the studies show that as first responders, our brains ramp up, and even like you said, we're at home watching a Disney movie, completely relaxed. There's no alarms going off. Our brains don't ramp back down to baseline. They have a much harder time. So the stellate ganglion can shut that
It's
off.
absolutely so. My wife has CRPS, the one I'm talking about. She had an injury and she has CRPS. And I was talking to a hand surgeon who I was working with, not her hand surgeon, but one I was working with, one as a clinical anesthesiologist. And he said, do you know about the study? He said, they took people with CRPS and did functional MRIs with and without. And they said people with CRPS, which is that chronic pain syndrome, their functional MRIs, the brain was lit up. That's exactly what we're talking about. So this extrapolates exactly to anxiety. It's the exact same mechanism. And I found personally a correlation between people who have high anxiety states and then have that injury, get CRPS. Wow. So the anxiety state's the setup for CRPS. So the same relationship.
Wow.
It's all the same. So these people, so if you ever find someone who has a chronic run into someone, you might even study with someone on a call, they have CRPS, they'll see this burning pain, maybe in a walker or a cane, and they have this chronic pain, and they're like, I feel like my leg is on fire all the time and I can't get out of it. That's what it is. And most likely, if you just ask like, hey, before your injury, do you feel like you're an anxious person? Many people don't recognize they're anxious, but if you dig into it, they have a high stress anxiety state. Wow. And so what happens, it seems to happen, is that as soon as they feel anything negative, I have pain, they panic. Am I going to stuck with pain forever? This is the worst pain I ever have. And so it's going down this like, now you can see how like, oh my God, they're already high anxiety state. Now they're more high anxiety state because they're in a pain cycle now. Yeah. And the more pain cycle they have, we told you the more negative emotional feelings you are, it increases your pain experience. Yeah. So you can see how you're kind of more, and now what happens, it hijacks your system. Oh, wow. So you can see how it hijacks your system in the same way. So the same way that does is that they shut off the nerve on the stellate ganglion block, shut off the nerves and break that cycle. And that seems to break that pain syndrome. It's the same process of, as soon as you understand how the nervous system works, we're just trying to interfere. Now, we can't, none of it's 100%, but once we understand this is what we're trying to do, we're trying to disrupt these signalings in our nervous system, and now we have a chance to fix it.
Yeah, absolutely. God, that's awesome. That's a lot of info, man. That is a lot of info. You got anything else, buddy?
No, I feel like I want to.
You're an expert now, and when people come up to you and said, "Hey, well, I should not be scared," it's like, "Hey, these guys like have studies and science behind what they're trying to do. So they're not here just trying to get you high."
It's not what you're. It's not what you're seeing on the news.
No, it's not what you're seeing on the news. Now, again, you talked about earlier. There's risk, right? And malfeasance, malusage, not using good intentions, and you can have problems. And so that's where like Matthew Perry, story came in. So that's where that comes in, is because he had very bad actors, doctors, who sold him in the parking lot, taught his personal assistant, which is not a doctor or a person, just his personal assistant, does his notes for him, making points for him, taught him how to get intramuscular injections. He kept on saying, give me the big dose, and he was doing it multiple times a day. Yeah. And on top of that, he was taking some agonist, antagonist, narcotics in the system for narcotic problems. Sure. And on top of, I think he was also taking some sedatives and maybe some alcohol too. And then he hopped in. Then he fell into a hot tub or jumped in a hot tub, which is never going to be good for your body.
Not allow that on board.
No.
Right, and again, I don't know the actual story, but you're going to have bad outcomes.
Absolutely. Dr. Wong with Advanced Wellness and Pain. Thank you so much for taking out some time from your day and coming with us.
Yeah, it was
very pleasure.
Thank you for all you're doing for our members.
Absolutely.
Seriously.
Get your members to come down and do a little ketamine program with us. I think.
Yeah, absolutely.
I actually believe everyone should do it.